Hi, I'm Jana.
And I'm Julianne. Welcome to our podcast,
Life in a Salad.
So Jana, how's your work week been going?
It hasn't been going. Just kidding. It has been. But I'm a nurse and I'm not loving it right now. So the hospitals are, I'm trying to think of the right word to say, overbooked. I guess you don't book a visit there, but they're just overflowing with patients. Everyone's super sick, and so we're understaffed. It's just not a fun time.
I feel like I've been hearing that a lot for hospitals in general and nursing from pretty much any nurse I know over the last few years.
Yes, I feel like a lot of people are leaving the hospital. I'm hoping to myself. I guess I feel a little bit bad for the patients, and if I needed good care, I guess I'd be like, oh, what do I do?
Well, and we've, I guess, recently been in the hospital too, not as patients ourselves, but our mom was recently there, so we got to kind of have that experience with everything.
Yeah, I mean, her going into the hospital, there's not really a lot we can do with her going in, and I think that's the case for a lot of family members. So it's just kind of a difficult situation. So how has work been for you?
It's been pretty good. So I work as a health coach and I work from home. So everything's pretty much virtual. Whatever I want my atmosphere to be like is whatever it's like at home. So that's actually pretty nice. So nothing too crazy there. Work can be stressful a lot. Just this time of the year, I work for a company and we partner with different businesses who start to offer health coaching and basically just different wellness benefits at the beginning of the year as people's insurance plans start kicking in. So this is kind of a busy season for me right now. I've had a lot of screen time, way too much screen time really. So that's been a little bit of a struggle just for me personally.
Yeah, I think, I don't know, I think healthcare isn't always as cracked up as it used to be, especially in the nursing field. And this past week, I actually texted Julianne while I was at work with this story. I thought it was ridiculous.
You were having a hard time.
I was having a rough day, difficult time. I was working observation. It's basically ER overflow kind of.
Yeah.
Anyways, short story, basically, I had this patient. He smoked a lot of cigarettes and told me, well, I smoke an okay amount. And I thought, well,
what does that even mean?
Right, like,
what is an okay amount of cigarettes?
No amount is okay, but he thought he was doing pretty good.
Yeah.
Anyways, there with GI symptoms, and he needed a surgery done. And the gastroenterologist, she's actually, I shouldn't say gastroenterologist, I can't even say it right. The nurse practitioner who worked with GI came in and said, like, oh, once we get your surgery done, like, you'll be able to go back to and eat all the foods you enjoy again, which I have nothing against people enjoying food. Like, I enjoy food. Yeah. But the big thing was just kind of like, this guy was a bit uneducated on what he should be eating, especially for his condition. And so to me, it was just kind of like, oh, here we go again. Healthcare providers giving out information about that patients can just go back doing what they're doing, and that's probably what led them there to begin with. So that was a little frustrating. I tried to talk to him about his diet, but once you're in the hospital, a lot of people are resistant to change, and they're like, well, I just want to be fixed and go home and get back to what I was doing.
I think too, so that person, the medical personnel that gave that advice, were they a doctor?
No, she's a nurse practitioner.
Oh, she was a nurse, that's right.
But regardless, I mean, I feel like, in healthcare, you're not really taught so much about diet. And nursing, we kind of are. I mean, we don't have true nutrition classes by any means, but we are given more of a natural approach or nursing interventions that you can do to try to promote health rather than, we're not prescribing meds unless you're a nurse practitioner. So that was just kind of, I don't know, ridiculous.
Yeah, I feel like too, this has been my experience, at least anywhere I've been in a setting like that, when the medical provider, that whether it's a doctor or a nurse practitioner or a PA, they're giving kind of this advice. Well, now if the doctor says it or your nurse practitioner says it, then they're going to go ahead and say, oh yeah, why would I listen to anything anyone else says once they said that they're going to be okay to just go back and eat whatever because the doctor said so.
Right. They're like, well, my doctor told me this, which I don't think you should necessarily go against doctor's advice, but I think you have to be cognizant on what works for you, what your goals are. Some people don't care to know. Some people just want another pill at the end of the day and mask their symptoms and move on with life. So
this is the struggle that we've been kind of discussing amongst ourselves lately. I'm sure a lot of people in the healthcare field have maybe come into similar situations where we just feel like it's a little bit of a broken system.
Yes.
And we don't feel a lot of support, I guess, from a lot of, maybe the other peers in the medical field that are kind of just spreading this almost like, it's not false information, but it's kind of just feeding a certain agenda, I think.
Yeah, I think, and it's not really their fault. I think it's more about, that's what they're taught in medical school, or if they're a PA, nurse practitioner, like, that's what you were taught. Why would you go against that? And that's medical textbook.
Yeah.
And so I can't really fault them. I mean, they're doing what they know, what they were taught.
The best they can.
And so if you're looking for something else, then you go look for something else, like alternative medicine. I mean, it's kind of whatever works for you. I think another issue is just a lot of patients coming in for what aren't really true emergencies.
Mm-hmm.
And I think a lot of chronic issues turn into what some people perceive as an emergency. I mean, I've been guilty of that myself when I felt like I didn't know any better. I thought, well, I'm in so much pain, I must go to the hospital.
Because you're thinking there must be an emergent situation.
Right. And sometimes there truly are, where maybe you have an appendicitis and that is, like, you need surgery and there's not really a lot you can do about that. Or you broke your foot and you need foot surgery, or you fell off a ladder, by all means, go to the ER. Like, I'm not saying that too. I think the big epidemic that I see in the hospital is just a poor lifestyle. I feel like, I don't want to throw out numbers, but I feel like 70% of the patients that I see that are like that, and a lot of it is from diet, from what I've seen. I mean, I feel like obesity is huge and causes so many chronic issues that I've seen.
Yeah.
I've seen it down to where patients become so obese, they're no longer mobile, they have skin breakdown to the point, like, their wounds are down to their bones due to inactivity, and I'm just so alarmed by this. And at that point, it's really hard to get better. And I think another takeaway from this, that myself, and I've even heard other doctors say this, is that the hospital is not a place to get healthy. It's a place to treat an emergency and you go home, and that's when you truly get healthy, especially from chronic conditions. It's not, oh, give me this pill and I'm going to feel better as soon as I get home. I mean, some patients do, but I just think some people come in with the wrong idea of, I can't leave the hospital until all my labs look completely perfect, and that's just not reality. That's something that you have to work on and be your own healthcare advocate.
I think it's kind of in the word too, chronic. What does chronic mean? It's not something that just happened recently. This is something that has been going on for months, if not years on end. And it's very likely that if you have a situation like that, it's most likely not an emergency situation. Unless it has come to a point where, someone has red flags, they are having a heart attack, they are having a stroke, something like that. But where you have chronic conditions for whatever they may be, they're usually not emergent situations. And because of that, there's usually not going to be a magic pill or surgery that's going to quickly fix those things either.
Right. I've seen this time and time again. I think of one patient that everything was appropriate for him to be discharged from the hospital. Even the doctor said, like, there's nothing more for us to do here. Like, you go home, get healthy. And he said, well, my shoulder's been bothering me for like the past year. I'd really like to get an MRI on it. And he wanted to stay the night for another night there because MRI was all booked up, so he'd have to have it the next day. They let him stay, but
I don't even know why you'd want to stay overnight in a hospital. Anyone that's ever been there, it's terrible. It's not a comfortable experience.
Right, I don't think so, but there's some patients that love it. So, everyone's different. I can't speak for them, but yeah, I mean, this costs the insurance more money, his health, I don't know what insurance he had or healthcare bills or how that looked for him, but it was just unnecessary and feeding into the system and just making the workload bigger. I mean, there's people waiting in the ER for a bed.
Who actually do have an emergent situation and can't get care because this happens.
Yeah, I feel pretty passionate about this working in there, especially when we have to start opening up beds or have.
Oh yeah.
Like I worked on a floor that we had to start making like makeshift rooms in the hallway. Yeah, and patients had. I mean, we put like these little walls around them.
Yeah.
Or borders to kind of like give them a little bit of privacy, but essentially you're in the hallway in a bed. I mean, it's just gotten pretty bad. I flew to 5 hospitals, so I see it everywhere.
And I think especially a lot of us have seen this the last few years specifically because we know COVID was rampant. A lot of individuals were coming down and being hospitalized for that, as well as there are other health concerns that may be happening. In addition to that, a lot of people were avoiding going to the doctor's offices.
Right.
So these issues that could have been maybe prevented suddenly were exacerbating other health problems, and then they were having, episodes, increased risk of, people having heart attacks, things like that going on. So the hospitals were just overflowing.
Right, and I think people are sicker than they used to be. I mean, I talked to nurses that have been nurses for 10 to 20 years, and they say a long time ago, before I was even in the profession, that things were not as bad as they were. We weren't handing out antibiotics as frequent as we are now, or how people just have antibiotics sitting in their cabinets and they're like, oh, I have a sore throat, I'll take an antibiotic, when maybe in reality they just need some honey and lemon water or something else.
It's so true. And what is, for some people, because I hear this quite frequently, even from individuals who maybe they have a sick child and they're trying to do what's best for them or for their family member, and they're like, oh, I have these antibiotics that we didn't finish, let's just give them to them and they're gonna, hopefully that'll help them feel better. But what happens when someone doesn't need an antibiotic and they take one?
Right, so you build up resistance, and the issue with that is that, let's say this person has a virus, an antibiotic for one doesn't even touch that, so you're treating the wrong issue anyways. So that's one thing. Another thing is that antibiotics, sometimes when people see that they're expired, like they'll just flush them down the toilet, or they end up in our water system, so we could be drinking them through tap water. And then the third issue is, or at least what I perceive to be, is that the more antibiotics you take, it wipes out your gut flora. And that's so important, because if you don't have good microbial gut flora, then you don't digest foods well. You can end up with all kinds of digestive issues.
Which is growing. A lot of people are having more and more issues with this.
Right. I've come across so many people with the gut issues, and I've had my own issues with it. And so I just think, if you don't need antibiotics, don't take them. I think there's a time and place. There definitely could be a reason. I mean, there are terrible...
And there are tests that will tell you that if you, have a bacterial infection, someone has strep throat or something that does need an antibiotic.
Right.
Then there are tests that can tell you that, and then you can get the medication for it. But just to take it on a whim, and then it creates these kind of super bugs. Exactly.
And so we see that a lot in the hospital, where there's an acronym called MRSA. It's almost become a word in the hospital, but it's methicillin-resistant staphylococcus, or aureus. Kind of a mouthful to say. We don't ever say that in the hospital. We just say MRSA. But it's highly contagious. We have to gown up if someone has that. And it's just really hard to get rid of, and so they have to use really strong strains for weeks and weeks. Some people have to go with an IV PICC line home to get these administered at home. And from what I understand, that basically by people taking antibiotics over and over again, these bad bacteria become so resistant to it that nothing cuts through them, and so people just get sicker. And I think that's part of the issue we've seen in the hospital, is that we have people there for weeks because they can't get well from these bacterial infections. So that's my 2 cents on it.
Yeah, it's kind of, and I know I've worked in different healthcare settings, so right now I'm lucky and I get to work from home. But I have definitely seen, I think that on the other side from like a PCP office, I worked there for several years. been a health coach in different capacities, but that was a big concern that we would see with individuals just kind of wanting to come in and get, and they would kind of just tell the doctor what they wanted to. They're like, okay, I need this prescription, and they almost get used to thinking that this is something they need to fix their issue, and it wouldn't touch it. So the doctors would just, some of the doctors would hold off and say no, but others, they just give the patients what they ask for and what they want. And then none of the medications touch them, so it just keeps on creating these issues.
At the end of the day, any hospital is a business, and so they have to make money. I don't think it's truly about money necessarily. I think we're trying to help people, but at the same time, if patients are unsatisfied with their visit and that's what they perceive or feel that they need, and they come to the hospital and don't get it, maybe they don't come back. And so that's definitely something looked into.
Yeah, I agree.
I think another thing that is big right now is, at least in the hospital, speaking of nurses, nurse to patient ratio, just talking about how busy the hospitals have been and how patients don't get proper care because we don't have the capacity or time to get everything done we need to do or give patients the attention that they feel they need. I try to as a nurse, it's just some days just are not possible. And I think because of that, you see more and more nurses leaving the profession because the patients are so complex, high acuity, difficult to take care of, that nurses are just kind of burnt out on it.
Yeah, and I think that's something that we're noticing not only with nursing, but the healthcare system as a whole, is a lot of people are feeling that burnout. I've felt that as a health coach, even in my capacity. I've noticed amongst other health coaching peers that I've worked with, the doctors. I actually used to work for, it's kind of a popular, I guess, hospital here in Arizona. So there are a lot of them, you maybe figure it out. But I did work there in basically an employee wellness type of position. And I did get the experience to sort of discuss and meet different healthcare workers in all different capacities, so whether they were doctors, nurses, phlebotomists, people that were in the HR area, basically just everyone. But it was pretty surprising to me how many just of the healthcare workers were experiencing exactly what we're saying. They were feeling burnt out. It's, at the end of the day, I think healthcare is meant to be there to help people, but a lot of healthcare facilities, I don't know if it stems from the top up and it just becomes more, a business focusing on the bottom dollar and how much money they're really making, but they forget to care about not just the patients, but also the employees that are working there. So everyone's kind of feeling that burnout. And that's what I noticed with most of the employees. I think I'd say they were maybe a PT, so the physical therapist, they seemed overall maybe the happiest from the individuals that I encountered. But some of the least healthy people I encountered were some of the doctors and the nurses, who were extremely stressed out, hated their jobs, because they were just being overwhelmed with the amount of work they were expected to do.
Yeah, that last day, this past week, I went to work. There were 2 other float nurses I was working with, and we were all just we want to get out of here, we want to find a new job. Yeah. And so I feel like that's where a lot of nurses are headed, or leaving bedside. I know there's a lot of talk all the time of what a shortage of nurses there are. And I think a lot of it stems from people not wanting to enter into the profession, or just leaving bedside altogether to where you don't have good nurses there anymore. Not saying the nurses that are there aren't good. I think they're great, they're doing the best that they can, but we just have a lack of it, and so it puts a strain on the whole system, I think.
Absolutely. So this is a huge problem that we've been discussing, and we've experienced it firsthand, unfortunately. And I think at the way it's going, if something doesn't change, it's going to continue to go that direction, and we have more and more people that are getting sicker, and we're again not really addressing a lot of these chronic issues at the root of the cause, which is sort of just increasing the amount of people that need health care, whether it's from their PCP office, going to the hospitals because situations are exacerbated, because ultimately we're not addressing what's really going on here, and we're continuing to overwhelm the healthcare system.
Right, and again, going back to there's so much that can be done at home,
Yeah.
and like healthy lifestyles, making small changes every day, and getting away from this processed, overstimulated lifestyle that so many of us lead. I mean, I feel like how modern life has gotten, that our bodies have not caught up with that.
Yeah.
Just all the things that can be produced now, and like we've talked about this in previous episodes of like toxins and parabens and all these different things, or unhealthy foods that are just leading us to I hate to say this, but like they're trying to kill us.
So we're not trying to be like conspiracy theorists.
No, not by
but,
any means.
But honestly, more and more research is coming out, and that's something that is very interesting about the healthcare field and science is I don't think you can ever, and if you come across someone like that thinks that they know it all, or this is the way which I know I've come across some doctors like that I've even gone to myself, that just they feel that they know it all. We don't know it all. There's still a lot that we are researching and finding out every day in the medical world and the science field, and so I think we need to be open-minded so that we can better address what's going on.
Right. Yeah, I think that's a good point too. I guess something else I thought of was I feel like a lot of this has led up to it being the way that it is during COVID, that there's just so much burnout by that. And I think you not just saw it in the hospital, but everywhere you went, and all like the mask mandates and how effective or non-effective they were. I know at the hospital they just dropped theirs where it's optional now that you can choose to wear a mask or not wear a mask. And I did travel nursing during COVID, and we were all required to wear these N95 masks. I would say it's probably the most effective mask I could wear at the time, but then it got less and less to where you could start taking care of patients in some hospitals with just your regular mask that you wear out in public.
And even if obviously everyone was getting it, right? So including medical personnel, and they would come to the hospitals and facilities with COVID knowingly, right?
Right. So I think like rules just kept changing over time, and those simple little masks that you could wear out in public, they were then dropping the rules saying like, oh, you can take care of patients just with this mask. And so you would have floors of nurses getting sick. And so to me, that kind of said
a lot.
Yes, it said
about the effectiveness of that type of mask.
Yeah, like this probably isn't even working at all. I mean, you can breathe in air pretty easily through that.
Well, and it's interesting. I mean, you can kind of think what you want on that, but it's interesting. So you notice that firsthand. Hospitals normally they used to at least recommend if something was truly contagious, you would need to be fitted specifically for an N95 mask. And that was the only way to really ensure that you were going to be, preventing that by wearing the mask. So, I think just thinking of how people, I know when we were out in society, people would wear the same masks over and over, just keep them in their bag, put them on and off just because it was maybe a rule, or I don't know if they just didn't understand the ways that they worked. So they weren't really doing anything. If you're not effectively wearing a mask, what is it really doing?
Right. And I think we saw that everywhere. I think I even saw you doing that.
Yeah. We kind of got to the point, I had COVID before, and we just thought we're immune, kind of.
Right.
And we got to a point where the rules were changing so much and lax, and no one really knew what to believe or what was going on. And it was a weird situation.
Yeah, I'm glad things have kind of leveled out, but the hospital is still stressful regardless. So I think the question is now, like, what can we really do about this? For me, I plan to leave bedside nursing. I don't think that's a solution to the healthcare problem by any means, but I think being an advocate for yourself and looking outside of ways that you can get healthy at home to prevent yourself from having to go to the hospital. I mean, accidents happen, and so a true emergency where you have something that needs taken care of urgently makes sense, but these chronic conditions, most of them, unless you're in a true exacerbation, can be taken care of at home, meaning leading the most healthy lifestyle you can.
Absolutely. And I think that's a big thing, whether we were talking about when COVID was going on or whatever new bugs are going to pop up, because, this is probably going to remain to be with us. The flu comes around every year. COVID's kind of morphing into different things every year. It's just there, the common cold, whatever it is. These things also get exacerbated if you have chronic conditions like diabetes.
Right.
So it is so important to focus on those lifestyle factors, which is a big part of, what I really enjoy working with members as a health coach. Like I said, I worked at a doctor's office previously, and to be honest, the doctors had very little education in any type of nutrition, exercise. A lot of them didn't really understand how any of that worked or what to counsel their patients. So basically, they would just say, "Yeah, eat healthy, lose weight, and
Right.
exercise," and that's
Whatever that means.
basic. Yeah. So that was something I found was rewarding, just to help to educate and work with people on that. But it really does come down to those root factors. How are you doing with your nutrition overall? How are you actually doing with living an active lifestyle, not just exercising, but really living an active lifestyle.
Right.
And getting enough sleep, adequate sleep, effective sleep.
Yes.
It's one of the biggest ones.
It's such a big thing. I feel like that, and decreasing your stress, because I feel like if you have high stress, it's hard to have a restful, good sleep. There's so much you can do to do that and find things for yourself to reduce stress. So I think that's really big.
Oh yeah, I agree. I think we could do I think we have done a previous episode on just stress management before, but I think that just making sure that you're focusing on all these different factors, and we'll continue to, of course, share and educate as we're able, because we're big advocates of trying to just get the word out there, promote health and wellness, and really at its core.
Yeah, I think, I don't know, sometimes, especially when I'm in the hospital, I just think oh, I wish I had the time to resonate with these people and explain everything, but it's not an overnight process. It wasn't for me. I always thought I was healthy. I mean, I think I was for the most part, or thought I led a healthy lifestyle, and there's always, I think, more you can do. And so I guess just seeing these people that I work with in the hospital and how much that they don't know, and that I want to help them more, just makes me want to spread it even more. I just want to tell everyone.
Well, and I think too, so we're going to, of course, try and share this information, but, educating yourself, and then, when you have that knowledge too, be your own patient advocate.
Right.
I know, when you go to the doctor's office, even as a healthcare worker, your doctors may not always know what's best for you. They may not have that full education and the capacity that we're talking about with those lifestyle factors, or what you can do for yourself. I have had to do that. I've gone to the doctor actually pretty recently, and had my own experience where I was going through my own kind of different hormonal type of concerns. I don't know for 100% or certain that it can stem to the COVID vaccine, but I do know that immediately after I did have that vaccine, I know that this has happened with other women as well, where some people's bodies, they don't always respond the same to different vaccines, different medications. And for me, right after having that happen, I started having where I was skipping cycles just for my menstrual cycle, and that was extremely abnormal for me. I've never had where I was skipping months like that before. So I think be aware of what's normal for your body. Just because it's not happening to everyone either doesn't mean that it's not real for you. And be your own advocate. Go to the doctor and explain what's happening, and let them know. I know for me, I had to go and explain what type of lab work I wanted to check out, what kind of supplements I had researched and looked into to help support me on trying to get myself back to a healthy regulation. And the provider I was explaining this to was kind of just going over their head, didn't really care, wasn't really listening to me, had in their own mind what was maybe the most abnormal case they'd ever seen, sharing that, well, that's still pretty good, that's okay, you're only skipping your cycle every other month, some people, they only have a cycle a couple times a year, so you're okay. That's what they told me. And I don't believe that that's something you have to settle for. I think you need to fight for your own needs and your own healthcare and be educated and aware so that when you go into those settings, including with your doctor, and hopefully you can find a really good medical team who supports you and is open-minded and continuing to educate themselves so that you can work together for your best optimal health, not just the bare minimum.
Yeah, so I love everything you said. I'm so big on that. And so my biggest takeaway for all of you is advocate for yourself. It's so important. And get that knowledge and education. Try to learn as much as you can, because the more you know, the more you can help yourself.
Absolutely. I think that was a great note to leave it on.
Yeah.
So we'll continue to be sharing more about just our experiences and educating the best that we can regarding different health topics. So be sure to follow us. We are going to be on Instagram, Facebook. We are just starting out on YouTube now.
Yes.
TikTok will be on there as well. And of course, for our podcasts, they're going to be available on iTunes